If you've ever held a trickling garden hose and needed to spray water all the way across the yard, you know the solution. You don't turn up the faucet. You simply put your thumb right over the opening, and the water instantly shoots forward with high force. In a life-threatening medical crisis, the body uses this exact same physical trick to stay alive. To understand how, we can map that garden hose directly onto the cardiovascular system. Think of the human heart as the mechanical water pump, and the vast network of arteries and veins as the branching hoses. In this system, blood pressure is simply the water pressure required to push oxygen-rich blood all the way down the line to distant vital organs like the brain and the kidneys. If the pressure inside those pipes drops too low, the pump's effort is completely wasted. The fluid pools up, and the organs at the end of the line immediately begin starving. In the intensive care unit, this specific plumbing failure is a critical medical emergency, known as shock. A very common form of this is called septic shock. During shock, the body's blood vessels inappropriately relax. They lose their normal rigidity and become dangerously wide and floppy, causing the blood inside to lose its forward momentum. In this situation, a patient's heart might actually be pumping perfectly fine, but that sudden, severe drop in pipe pressure still puts them in mortal danger. When this happens, doctors do not focus on fixing the heart or pumping in extra blood. Instead, their immediate priority is finding a way to drastically tighten the pipes to restore the lost pressure. To achieve this, doctors rely on a frontline medication called norepinephrine, which is also widely known in hospitals by its brand name, Levofed. This drug is actually a synthetic copy of the fight or flight hormone that the human body naturally produces during moments of extreme panic or physical danger. The medication targets alpha-1 receptors, chemical buttons on blood vessel walls. Locking into these forces the floppy pipes to aggressively tighten, biologically mimicking a thumb over a hose. Simultaneously, it activates beta-1 receptors on the heart, instructing it to beat harder and faster. This page from a critical care textbook highlights clinical data on these combined effects. Looking closely at the special points section near the bottom, it confirms that noradrenaline, which is another name for norepinephrine, is the absolute drug of choice for septic shock. By simultaneously revving the pump and aggressively squeezing the pipes, norepinephrine rapidly reverses the fatal pressure drop and pulls the crashing patient back from the brink. But the extreme squeezing power of this drug introduces a unique danger called extravasation. Extravasation happens when the medication accidentally leaks out of a standard IV, squeezing the small arm veins so tightly that the surrounding tissue actually dies from a lack of blood flow. To bypass this danger, doctors use a central line, delivering the medication directly into a massive, sturdy vein located deep in the chest or neck. This safely dilutes it into a fast-moving, high-volume stream of blood. This pharmacokinetics chart illustrates another clinical hurdle. You can see here that the body breaks this hormone down incredibly fast. It lists the onset as immediate, but the duration of action is only 1 to 2 minutes. Doctors manage this short lifespan by delivering the drug as a continuous, perfectly calibrated IV drip. It runs 24 hours a day, constantly replacing the molecules as fast as they are cleared, until the patient fully recovers. The sheer potency of norepinephrine demands an extreme level of control. ICU teams take a chaotic, natural panic response and turn it into a highly calculated, steady lifeline. All of this reveals the ultimate illusion of vasopressor medications like norepinephrine. It manages to rescue a crashing patient without adding a single drop of new blood or intravenous fluid to their system. Instead, the medication saves lives simply by altering the size of the container holding the existing blood. By dynamically shrinking the container tightly around the fluid, it forces the internal pressure back up to safe levels. So the next time you hear a medical drama or a news report mention that a patient needed blood pressure support or vasopressors, you now know the invisible mechanics at play. Doctors in the ICU don't always need to replace what the body has lost. By putting a chemical thumb on the hose, they can force the body's existing systems to work under pressure. If you found this breakdown helpful, please subscribe to ICU Simplified for more critical care deep dives. Thanks for watching.